field and within our communities to build community-based partnerships. We do provider education, engagement. I manage operations and oversee program delivery. And just a little bit about my background. I have a bachelor's of science in behavioral sciences with a minor in community engagement and emotional intelligence and leadership. And I'm also a trained tobacco treatment specialist. So just a little bit about me. But really, I want to showcase my colleague, Maxine, who's there in New Mexico. Maxine holds a master's degree in social work from New Mexico Highlands University, and she has over 20 years of healthcare and community health experience. Prior to her joining Optum, she worked as a preventionist for North Central Community-Based Services in Chama. Did I say that right, Maxine?
That's right.
And okay, and in this role, she traveled through an extensive territory of northern New Mexico to implement community substance abuse prevention programs, lead substance abuse town hall meetings, and coordinate activities from the Northern Rio Arriba Community Health Coalitions. In addition to this training and outreach experience, Maxine was the office manager for a general surgeon and family practitioner. These roles have provided her with the skills necessary to effectively work with clinical staff and providers. Maxine has been a health systems change specialist working with providers throughout the state of New Mexico for the last 5 years. So we're just going to kind of go over some of these items. We'd like it to be informal. I'm seeing the chat board out of the corner of my eye, or the Jamboard going. So please, as you have questions, etc., throw them on there and we'll try and look at them as we move forward. But I'm going to go over to our next slide, which is, if it works right, as it should, with our next. So let's see if it will work. All right.
Okay, so the New Mexico Health Systems Training and Outreach Program launched in 2014, and it started out with Esther being our systems change specialist. Then I came on board in 2015, and the variety of organizations that we served, and we help practices and health systems to develop sustainable approaches to tobacco treatment. Organizations served by the program include community health centers, rural health clinics, community and critical access hospitals, oral health organizations, family practices, and federally qualified health centers. A little over 2 years ago is when we started working really heavy with the behavioral health centers and private organizations that deal with behavioral health issues. I've also focused a lot on Indian health service clinics and hospitals, as well as the tribal and Pueblo-based health systems throughout the region. So being part of the organization that operates the 1-800-QUIT-NOW resource for New Mexico puts us in a unique position to extend our work to the behavioral health providers. We have over 20 years of experience in managing tobacco quit lines, and we can leverage that expertise to assist the health systems we engage to utilize the best practices for tobacco treatment.
Great, thank you. So our program goals, this is just a little slideshow or a picture of what our goals are with our program. We want to be able to assist you as the provider in identifying treatments of nicotine addiction in behavioral health. We'd like to help improve your clinical systems, incorporating in the ask, advise, and refer to quit nicotine and referral to treatment resources. So I hope you're paying attention, because there's some little questions on our Jamboard later. So just be listening closely to our resources that we have here. And we want to be able to develop and build the sustainable systems to support referrals to New Mexico's nicotine addiction treatment services.
Okay, according to SAMHSA, approximately 25% of adults in the United States have a mental health or substance use disorder. for example, behavioral health condition. And this can include anything from anxiety, depression, schizophrenia, any kind of mental health issue. And these adults consume almost 40% of the cigarettes smoked in the US. And which is really, really sad, because these individuals that have these mental health issues aren't dying from the mental health issue that they're having to go through, that they live with. What they're dying of is the tobacco use that they usually use, and they use it for several reasons. And although smoking has decreased in certain groups, such as people experiencing behavioral health concerns or substance use disorders, we still have higher rates of smoking. They still have higher rates in smoking than the general public.
Right.
And you've heard this call to action before, but I think it's important to note the impact of nicotine addiction before talking about changing the system to address it. Individuals with behavioral health conditions are more likely than those without such conditions to smoke, and to smoke more heavily. And they account for nearly half of all the tobacco-related deaths each year. And we're currently experiencing up to 480,000 people die each year of tobacco-related diseases. That's 240,000 people we are talking about. And that's a lot of people. The average number of cigarettes smoked per month was higher among adult smokers with any mental health condition than among adult smokers with no mental illness. And to put it kind of like in a number ways, we're talking about 326 cigarettes versus 284. That's a big change.
Okay, so we're going to head over to our Jamboard right now. And in our next, if you look at that second slide, there should be a question that we want to know, what are some of your thoughts around nicotine addiction and cessation efforts?
Do you guys want me to share my screen again? Or
Sure, if you would like that, that's fine.
I don't think we need to. I just don't want to goof up the tech.
Yeah, I think let's just, if everybody could go run over to the Jamboard and enter some of your thoughts around that addiction and cessation efforts, we can try and read some of those and debunk or address some of those thoughts and issues that we have there. Give everybody about 2 or 3 minutes.
So in the Jamboard up at the top, go to slide 2, just use the arrow going to the right.
Or Krista, should I try and share my screen?
You can.
All right, let's see if I can do that. I think by the time I figure it out,
You know what? let me do it. I'm going to stop the share on you, and then I'm going to share it from me. I think since you've got your PowerPoint up, we have it.
Yeah.
Okay, so here we go. So it's the second slide. So up at the top, if you're not there yet, take a moment. Oh, they're coming through. You guys are going to be pros at the Jamboard when we're all done with this. It'll be amazing. Okay, I'm going to put the Jamboard link in the chat just in case you're coming in a little bit late. Give me a moment.
Yeah, you guys are really putting some great stuff up here. They've got some that says there should be some sort of policy that will prohibit therapists from prescribing tobacco for patients. And relapse of substance, ensuring enough support.
This is great. This is all in line with what we're going to be talking about.
Yep, absolutely. Okay.
Right.
All right. Well, I appreciate that. I think they're slowly stopping. So,
I'll go ahead and stop the share and give it back
okay.
over to you.
All right. Thank you.
Mhm.
Okay. Come on. There we go. So here, let me go back. Sorry, Maxine. So one of the questions here was one of the items is there's no resources for providers and staff to build nicotine treatment skills. And I just want to kind of have that conversation that there may be no training infrastructure for staff and providers to build nicotine treatment skills, but that is where we can come in and help navigate and identify the treatment skills that you might need in your practice. And in a few moments, I know we're going to review some of those resources to go around that are available to you. Maxine, do you want to cover this one?
Okay, providers believe that individuals are unmotivated and unable to quit. Research is showing that the opposite is true, that they do want to quit, and they want to quit because they know that it makes them feel better, and it's expensive for them. They can't afford to keep doing everything.
Yeah, I think it's important to know that like 70% statistics are showing that 70% of those in this population report wanting to quit, roughly the same as the general population. So I think that's really important. Another one, a concept out there right now is that vaping is safer than smoking, right? Maxine, do you want to talk about that a little bit?
And that's not true, because a lot of individuals are under the misconception that it's just water, right? Hot water. That's not true. It's an aerosol. It's not steam. It's an aerosol that they're actually breathing in. And aerosol is bad for our lungs. Okay. And then you're talking about additional particles that come into play, like the different flavorings. It's actually been proven that there's cancer causing ingredients in some of those flavorings. It's very, very addictive, and individuals that are vaping are actually vaping at a higher rate than if they would have just been smoking.
Right. I think most e-cigarettes do contain nicotine, which again, as we know, is the addiction, which is highly addictive. So they're getting addicted to the e-cigarettes just like they would with any other tobacco products or services. Another misconception is that will negatively impact medication. That there's also a relapse of substance use or abuse, or reoccurrence of symptoms, which again, that's a common misconception among providers, that tobacco cessation will lead to a reoccurrence of symptoms. A relapse of substance abuse will negatively impact medications, but that's not true. In fact, evidence is showing that cessation leads to an overall reduction in anxiety and depression, that it improves sobriety, that with careful monitoring, you may find that your client actually requires lower doses of various medication to achieve the same therapeutic results. That includes some psychotropic medications. This is another big one.
And it's
Right?
not true that yeah, advising individuals to quit nicotine would be taking away their only pleasure. That's not true. Providers report concerns advising individuals to quit tobacco will be taking away their only pleasure, yet evidence demonstrates that tobacco users confuse the relief of their nicotine withdrawal by smoking with feelings of relaxation and pleasure. Tobacco use actually leads to chronically high stress levels, and research demonstrates that these stress levels decrease following cessation because it makes our blood pressure go up, right?
That's right.
Okay, so why should behavioral health providers treat nicotine use dependence? The nicotine's impact alters a person's mood. Okay, and if an individual, research is showing that a person's brain is not fully developed until the age of 25. Therefore, it changes their whole thinking process. There's even been some research showing that they actually might have some memory loss, and that's an issue right there. And it temporarily can increase the negative symptoms of mental illness. Let's say they haven't smoked a cigarette and they're one of those chain smokers, and if it's been like 15 minutes that they haven't had one, my goodness, their stress levels are high, their anxiety levels are high, and they might react to that. The treatment impact, it's associated with an improvement in mood and quality of life. And there's research does show that there's a reduction in depression, anxiety, and stress, particularly in those with psychiatric disorders. The outcomes are that behavioral health and substance use treatment outcomes can be improved, because when we feel better, our bodies feel better, that influences our mental health. And so we feel better all over, okay? All over. It's a continuum of care.
Yep, absolutely. And I'm sure you guys have all seen this before, but addiction is addiction is addiction, right? And I think that this is an important piece. I know you all may have heard this before, but we need to remember that the nicotine is the drug in the tobacco products. That is the addiction. That is where they become addictive or addicted. And it also, there's evidence to show that the nicotine is the trigger for other substance uses. And so we really need to make sure that when you're addressing other substance uses, you're also looking at nicotine. And I know that this is our soapbox, if you will. This is what we're really passionate about. But we're really working hard to show you the evidence around the behavioral health population on why it's so important to treat every addiction that your patient may be experiencing that at that point. And I think you guys can read the other 2 points there. But again, I don't want you guys to think that we're just here to preach to you about what all is happening and how to address or why you should address nicotine addiction as your overall treatment plans with your clients. But we want to give you those free resources. So, right, we can sit here and preach to you about why it's important, etc. But we have free resources for you that most people are not aware of. And that's why we're here to talk about that with you. So I need you guys to utilize your bars here, but show of thumbs. Can you give me a thumbs up or thumbs down? Who knows about the 5 A's? Okay, we got one no. What's everybody else giving me? Got a couple thumbs up, couple thumbs down. All right. Okay. So I'm just going to briefly go over the 5 A's. So this is the 5 A's, which is ask, advise, assess, assist, and arrange. This is also known as the brief tobacco intervention. And this is an effective way to help tobacco users quit. This came out of many years of research under the National Cancer Institute, and it was developed by that. However, studies have shown, and we know that the behavioral health groups don't always have the resources or time to arrange and assist and assess the tobacco cessation or their tobacco use for their clients. Individuals with behavioral health conditions or substance use disorders need more intense interventions, right? And so that's what we know. So including a discussion of medications to address the physical addiction, as well as working with them and connecting with that client, building that therapeutic alliance, and utilizing CBD services are all ways that our program can help your patient in that journey. So I just wanted to make sure. But like I mentioned, we recognize that you may not have that time during sessions to conduct and create a quit plan. And if you need to focus on other topics during your appointment, we have an abbreviated version of the brief intervention that may be helpful. So, Maxine.
Yeah, and that's the 2 A's and the R. So it's it's ask, advise, and refer. Ask them about their tobacco use. Advise the patient to quit because it will make them better and improve their other conditions, and refer them to resources. Now, what we need to remind you all is that this is a team effort within all your staff. Okay, one person doesn't have to do everything. It can be divided amongst several individuals. And that's what makes it so effective. And it has been proven to be effective. It is an evidence-based program.
Yep, absolutely. So our next question, ready to, I guess, Krista, we're going to have to go to the Jamboard again, is, there it goes. Okay. How can you make sure you address nicotine addiction as part of your treatment planning and routine care?
All right. I'm switching.
I know.
I would, if it was with my kids, I would add a song to this.
I know. I was thinking we needed like a Jeopardy song, or the Jeopardy. Do, 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 do.
Okay, can you see it okay?
Yes.
All righty. So if you'll scroll over in your Jamboard on your computer, over at the top, go to the third frame to get to this page. I see someone is on the page. We're there. All right.
I love this one. Having the time to set aside to create a personal quit plan, or asking them regularly if they are ready to quit, and having those resources. Educate staff on what resources are available in New Mexico. Oh, music to our ears.
Yep. I would say bring it up and ask if the client wants to work on it, and educate as to why it is helpful to address it. Very good. Good job. Yep, nicotine is going to have an effect on their meds. And just FYI, did you know that even the secondhand smoke from smoke, the secondhand smoke can also affect the medications prescribed? Make sure to ask about nicotine use. Good job. Make sure that the individual understands that there are resources. Good.
Yeah.
Share resources and materials with colleagues, partners, coalition members, everybody. Yeah, everybody.
I love the motivational interviewing with clients. I think that's so important. And I know that's pounded in your head during your experiences in your education. But I think it is simply just asking how motivated they are to quit, and if they're ready to quit in the next 30 days. Those are all really great ideas on how to incorporate nicotine addiction in your treatment planning and routine care. So thank you.
Do you want me to go ahead and stop share?
Yeah, that would be great. Thank you.
Oh, you're welcome.
So guys, just like I mentioned, and again, we're trying to make this as informal and kind of have some engaging conversations around this to help you and to provide these resources. But I also wanted to point out why we have these. So as I mentioned, the Health Systems Change Training and Outreach Program, with the help of the New Mexico Nicotine Addiction Treatment Services, also known as TUPAC, offer free services for the New Mexico Tobacco Use Prevention and Control Program. And our team of specialists can help you. And I think that that's an important piece. So what we're going to do now is just go over some of the resources that you may or may not know that are available. We have a phone-based program that's available 24 hours a day, 7 days a week, which gives and works with each individual because no nicotine habit is the same. We have to remember that each person has a different habit, and we need to meet them where they are. So we have to personalize that quit plan, just like with any other coaching or counseling session. We have self-help materials too. So when the client or patient decides that they're ready to quit and they call and enroll in our program, we send out a quick kit, a guide that has a step-by-step instruction. It's kind of like a workbook that they utilize that they can access anytime to really help identify those triggers, to help identify coping skills on how to quit and to stay quit. And they have access to an unlimited sessions with our trained quit coach within our system. And I think that that's another piece when you're referring a patient to another service, that you understand what we are providing to them. We do offer gum patches or lozenges while supplies last. And again, that's that evidence base that we lean heavily on, that we know that with coaching and with product, that your client is able to have a more successful quit attempt if they have those two items. That NRT is shipped directly to the participant. And we also have services for youth and for pregnant women. So we have all of those items. So that's the phone-based program. Then we have our web-based services, which offer quite a bit of the same items, but they do have some significant differences where there's a community forum, so that if a person, especially our millennials and our younger population and some of our older population too, really get a lot out of unfortunately in our COVID world where we're used to interacting online right now. So that community forum. And then we have the internet-based activities that can be integrated with our phone program. Maxine, do you want to go over text messaging?
Yeah, and then we have the text messaging support, and a person can get up to 300 messages, and it's tailored to their personal quit plan. I've actually seen a person's text messages, and they were really, really cool. She got them on a daily basis because she was such a heavy smoker and she needed that support. And they were so good about sending her a text message every day. And about calling the quick coaching call reminders. It was just a cool thing to have, and everybody texts now, right? Even grandma and grandpa. And then we have the a la carte services, which is new. And they can select text messaging to receive tips and games and reminders, a free 2-week starter kit of patches, gum and lozenges, and practical resource quit guide, and a series of emails if they sign up for it, full of tips, advice, and encouragement to help a person quit.
Yep.
It actually works. And when I first started working, I actually called the 1-800-QUIT now at 2:00 in the morning to see if somebody really answered or if it was a machine. And it's a real person. It's a real person. So I was like shocked, and I was like, I'm sorry, I called the wrong number. And I got all nervous about it, but it does work.
It does indeed. And I think it's important to know too that our coaches that are answering the phone and that are part of the texting and web base they go through really extensive training to become a coach. They're all, um, They all have 4-year degrees. They know their training requirements are over 6 weeks of intense training. And so that's another great piece to know, that you're not sending your patient to somebody that doesn't know what they're talking about. That evidence, they have to go through very rigorous training to become a quit line coach.
Okay, so I just saw this chat from Natalie asking if this presentation is done in Spanish. Natalie, I am bilingual, and so it's more like a Spanglish kind of thing, but I do get the point across. Yeah, but one cool thing you need to know about the 1-800 program is that anybody can use it. It doesn't go on gender. It doesn't go on citizenship. It doesn't go on any of that. Anyone can use it. And when they do call, we do have it in Spanish. And as far as the training goes, I am bilingual. I can do it. And then I always have somebody there to support me for those words that I haven't used in like forever. Okay, so we'll go on into the fax referral system, the fax referral program. This is the way cool way to do it. Okay, so like the fax referral program, I introduced this, and it's a perfect way for all the organizations to keep track of the individuals that have actually signed up for the program. When they use the fax referral system, the quit line will send the clinic a fax back report within 2 to 7 days after completing the phone outreach. What happens is the clinic fills out the top part, the provider information part, and they can pre-populate this and make a bunch of copies. And then the patient can fill out the bottom portion of it. And the cool thing is that the client patient, they can pick out 2 hours anytime during the day that is best for them to receive a call. Okay. The issue is that it's going to be a 1-800 number. So like most individuals, none of us answer our 1-800 calls, right? Because it's a sales call. But I teach the staff to, hey, remind your patient that they're going to be getting a call, for example, from 7 to 9 o'clock at night on Thursday night from a 1-800 number. They need to answer the phone. Okay, so this report indicates if the patient was reached, if they accepted services, and other helpful information such as their planned quit date and whether they screen for cessation medications. Okay, when providers receive a fax back report, there should be a process that the clinic or organization follows to ensure that the reports are being retrieved and filed away, and most importantly, recorded in the patient's chart. This is such a cool thing because see, it takes away that pressure from the patient having to make that call. Somebody's going to call them, right? So it's just better. It's just easier. We don't have to remember to call.
The other thing is, and I think that this
And
is
I'll have more.
Yeah, I was going to say, sorry, Maxine, go ahead.
No, go ahead.
I was just going to
I'm
say
good.
it's
I just get excited.
I understand. And I think that the other really important piece is that, what do we all do when we get brochures and materials when we're leaving the doctor's office? We usually find it in the back of seat of our car, maybe a week or 2 later, unless it's a prescription. And so this fax referral form really helps take that pressure off the patient, especially if you're asking them if they're ready to quit and then advising them to quit. Then they say, yeah, you know what, I really am ready to quit. And so this is another tool that we can use that utilizes that service. And like Maxine said, having that follow-up and setting that expectation with the client is really useful when we are setting, hey, this is what's going on next, this is what you can expect, etc. So thank you, Maxine. So I just wanted to kind of reiterate where we've been in New Mexico and how we've been able to help New Mexicans since 2019. So the Health Systems Change Program has had a variety of sites, clinics, or practices that we've utilized. And what I think is so important is to see those behavioral health sites, those medical clinics, and those hospitals that have been engaged. So this isn't something that we're kind of new in the field. We have been doing this for a while, like Maxine mentioned earlier. But there continues to be that cultural of tobacco use, right? And here's the provider types that we have engaged in with our health systems change program. So, but the problem is that as time goes on, we have forums for discussions like this webinar, right? That about tobacco, about nicotine, but nicotine is sometimes still being normalized in behavioral health settings, and cigarettes may be used as a reward and withdrawal, as consequences. And that remains the misconception that nicotine or tobacco is not as harmful as other drugs. Yet we know that a high number of the behavioral health clients and the patients are suffering, like Maxine mentioned, and dying from tobacco-related illnesses. So again, these are just who we've worked with and where we've been. But in a nutshell, Maxine, do you want to take this one?
Okay, so we're here for you.
Yeah.
You have to have a passion for what you do, and I have a huge passion for tobacco prevention and nicotine addiction treatment. I do. I've seen immediate family members die of it. I've seen friends die of it, and it, at a young age, and it was really, really sad. When we go see our physicians or our therapists or any of that, we expect them to ask us certain things, right? We kind of roll our eyes and we say, oh, no, not again. But we really expect them to ask us. And I think once we understand that as behavioral health specialists, hey, it's okay to ask because they're really expecting you to ask. Because if you don't ask, that means, oh, you must not care about me, right? It's just kind of a misconception how we think. And more providers working with the clients to address their nicotine dependence. They really are, because we work statewide. Okay, there is not a clinic too small. There is not a clinic too big. We will train one at a time. We will train up to 30 at a time.
Yep.
But it's important that they all know the resources, and we're the resource. There's also a higher number of sustainable systems, referring to the New Mexico Nicotine Addiction Treatment Services and other cessation service resources. Man, that was a mouthful. But we work with we work with LGBTQ. We work with, like we said, pueblos, tribes, and all of this presentation, and I should have said this at the beginning, and I apologize. This is all related to commercial tobacco use. But we still have to train individuals the difference, right? And I go through all of that, and I've been certified to do that. So yeah, the more the word gets out, wouldn't it be wonderful if we had a smoke-free world? There would be so many more healthy people in the world, I think. Yeah. I don't think I know. Okay, I'm off my soapbox.
No problem. All right, so we're getting ready to wrap up, and I guess the next question that I have for you all, again, is to reiterate that we are here. But let's go back to the Jamboard, and what we want to find out are from you, what are some of the nicotine treatment resources that you know about? Yeah, so we're going to go to the Jamboard. I do believe it's on the Jamboard number 4. And Krista, I think, is going to change. Yep, thank you. Not just online, but in general, what are some of the resources that you know of? Okay, I'm not I'm sad to hear that you don't know of any, but this is good. This is why we're here, to help you navigate and to identify some of those resources that are free, right? So I want to make sure we know that they are free, and that they are available to all New Mexicans. And I think it's really important to point out too that TUPAC has really made it a priority to remove barriers for your patients so that they can access products and services free of charge, without, those barriers that we may experience when we're getting a prescription filled, for instance, where, you have a pre-authorization going through insurances and stuff like that. That doesn't happen here. We mail out the product directly to the patient. And I think that is another important item to mention. So we've got phone apps. TUPAC is the greatest resource. I could not agree more. Quit line programs through insurance agencies. Some primary care providers offer it. Absolutely. Medications to help quit. Yep. And just a little tidbit, there are 7 FDA approved products right now that are approved for smoking cessation services. New Mexico covers the NRT piece, the nicotine replacement therapy. So patch gum lozenge fall under the NRT piece. The medications are nasal spray, inhaler, Chantix, and bupropion. So just so that you know. Okay, so I think we're gonna go and share our resources, right? So I think that's the next phase here.
And I'm going to jump in really quickly. I know it's the top of the hour. If anybody needs to pop off, not a problem. We understand. We are recording this. We will be making this available online. But if you do have the time, we'd love to have you continue on.
Yes, thank you, Krista. I appreciate that. The next slides are really just about what we have to offer to you guys. So here is Maxine. Do you want to talk about what we're looking at right now?
Oh, okay. I was reading the chat box. I apologize. Okay, so I do virtual training. Usually before pre-COVID, I travel all over the state. Okay, so I would go to you, take you to lunch, take you for coffee, do whatever, introduce the program, and I do training on brief tobacco intervention, the Fax program, and the 1-800-QUIT NOW. And we get into some really thorough training. So with examples, and everything is free. Don't forget, everything is free. We can do lunch and learns. But for right now, it is virtually, and I can do the whole training virtually. And I can also have lunch delivered to your office. And while you guys are eating, I can be speaking on the computer. Okay. So that's a positive, right? And we have this thing going on now that if an office will do 10 fax referrals into the 1-800-QUIT NOW program, that I will provide their entire staff lunch for one day. And so, hey, you can't beat that, right? So all of this training that we did is more thorough. It is available online, and we also have it online on the TUPAC website.
And I guess those are the next couple of slides here, but we're just going to review what is on the New Mexico TUPAC as resources. So I don't know if anybody has been out there to look at the resources there, but we have all kinds of information, and you can send your patients to on the New Mexico TUPAC resource. If you go to New Mexico TUPAC or nmtupac.com under resources, you should see all of these. If you go to quitnownm.com, then you can utilize a new click to call feature where a registration specialist from the quit line will call your participants or your patients back immediately to enroll them in one of the quit line benefits. So that's another great tool. We have promotional materials to utilize there. So if you go here to this order materials website, you can order all of the provider cards, Spanish cards, English cards, acrylic stands with inserts to provide to your patients. Sorry, Maxine, I think I went over what you were supposed to cover, so I apologize. I just was trying to get this. Another really great one is that we offer CMEs and CEU credits on the brief tobacco intervention. So utilize us, lean on us. We're here to help. And I think that that's a really important piece of it all. Here is our contact information. I believe Krista sent that out at the beginning of the email. And so I apologize. I know it's 4:02, but we are happy to stay on to answer any questions that you may have. We love the chat and just wanted to make sure that we address anybody, but be aware of your timing as well. So thank you.
Oh, Memory, she's 2 hours ahead of me. Yeah, she's in Delaware. I'm actually in New Mexico. So she forgets. Well, we actually both forget because I get up early.
Oh, wait, I'm sorry.
But,
yeah, I'm sorry. Top of the hour. Sorry.
Yeah. But anybody can call me or text me on either phone number, email me, and I will be more than happy to get back to you as soon as possible. So I'm excited. I'm excited to meet each and every one of you in person.
Wonderful.
Thank you so much.
Thank you both so much for this. The last item on the Jamboard is what support could we provide you in your efforts? When you get a chance, this link is open. You know, if there's something that you think about at a later point, go ahead and fill that. You have access to that link at any time, and we'll send it in the follow-up. But I just want to thank both Joe and Maxine for the work that they do. We're really here to support you as you support your clients. And I hope that this presentation allowed and communicated that as much as possible. This is just really a fantastic team. You can reach, you know, any of us for anything. Joe, Maxine, myself, Natalie. We've just got an amazing team that's here to support you. So with that, I'm going to just take a look at the chat really quick. Everything I think looks pretty good. Our next meeting will be on April 28th. I am just finalizing who our presenters will be. So as soon as we have that, we'll get that out. I'll go ahead and get the calendar out ahead of time. But again, a special thank you to both Joe and Maxine. Thank you so much for all that you do. And for all of you who are on today, with that, have a fantastic rest of the week. Stay warm, stay safe. Take care.
Thank you, everybody. Bye-bye.
Bye.
Thank you.
Thank you. Take care.
Thank you, Memory.